Okay, so hello friends, today our topic is the hypolipidemic drugs, also called the lipid lowering agents. Okay, so mainly they are classified as four. So first one is the statins, next is resins, next is fibrates, okay, and next is niacin. So we will see the mnemonic of every category and mechanism of action. So let's start one by one. So first one is the statins. So first see the mechanism of action. So normally HMG CoA is transferred to mevalonate and further many step it converts into cholesterol. So this here the enzyme is known as HMG CoA reductase. Okay, now statins will block this enzyme effect. What will happen? Cholesterol synthesis decrease. So the drugs under this, let's see the mnemonics. Here you have to remember a line that is sharp, lovely, pointing, force. So first see first these three things: lovely, pointing, and force. So lovely, take L for lovastatin, okay, P for pravastatin, and here it is F for fluvastatin. Next sharp. So sharp you have to write down, this is SHARP. is for simvastatin, H for, sorry, H is there is no drug, A for atorvastatin, R for rosuvastatin, and P for pitavastatin. Okay, okay, so now resins. So let's see: stomach, and this is small intestine. So here resins form complex with the bile acid. Okay, so this is the formation of drug, that is the resin and bile acid complex, okay, which is carried out of the body. So what will happen? Decrease amount of bile will decrease. So these two compensate, liver will produce more bile. So increase of it will need cholesterol, okay, cholesterol. So now in the liver there will be, this is liver, okay, so there will be increase LDL in receptor, LDL receptor on liver. How it will come? Here it is the blood vessels. So from blood vessels LDL will come to the liver. So as a result, decrease blood LDL. So drugs, you have to remember a mnemonic here. Let's say triple C. So first C is for the cholestyramine, next C is for cholesterol, and this is for cholecystectomy. Okay, so this is resins. Now come to the fibrates. So how they act? So first is the mechanism. So they are PPAR alpha agonist. Okay, what is PPAR? That is paroxysmal proliferator activating receptor. So now lipoprotein lipase activator. Okay, they are also known as lipoprotein lipase activator, which cause decrease TG triglyceride. So here the mnemonic is fibrates BCG. BCG is a vaccine, so you can remember. So fibrates will take F, and here BCG is whole. So F for phenofibrate. Phenofibrate. Okay. B for bezafibrate. Bezafibrate. Next C for clofibrate. Clofibrate. And Z for gemifibrate. Fibrozil. Gemifibrozil. Okay, so this is fibrates. Next is the niacin. So let's see the mechanism. Niacin has two effects. So first one is on the liver. This is the liver. So there are several effects. First one is it is decrease the TG synthesis. Next, increase the HDL and decrease lipoprotein. Next on the adipose tissues. So what they do? Increase the lipolysis. So fat breakdown will occur here. So here the drug is niacin, also known as nicotinic acid. Okay, vitamin B3. So the use of this is add-on drugs. Okay, use is add-on drugs to statins and fibrates in case of resistant. So in case of resistant we can use niacin. Okay, resistant case. Okay, now come to the new drugs. So first one is the ezetimibe. So now see the mechanism. So they inhibit the sterol absorption from GIT. So how? By inhibiting the NPC1L1 transporter. Okay, which cause decreased cholesterol absorption. So as a result, decreased LDL in the blood. Okay, now drug is ezetimibe. Next is the PCSK inhibitor. What is PCSK? That is protease enzyme. Okay, protease enzyme that degrade LDL receptors on liver. So this is a protease enzyme. Let's take this is the liver, and on the liver there is present of LDL receptors which take LDL from the blood. LDL. So they inhibit. So now PCSK, this is a protease enzyme which cause the degradation of these receptors. So in the blood LDL will increase because it can't able to come to the receptor, and as a result blood LDL will increase. So inhibitor will inhibit the enzyme and it will not able to act on these receptors, and normally LDL will able to bind on these receptors. So here the drugs, there is two drugs. First one is the evolocumab, okay, evolocumab and alirocumab. Okay, next one category is the mipomersen. So they are antisense oligonucleotide, okay, which results decrease in ApoB100 production. How? The genetic cause, suppose this is a gene DNA, and in the DNA mutation occurs, okay, which cause defective RNA production, defective mRNA, so defective protein. Okay, so that's it for the hypolipidemic drugs. So guys, if you like this video, then please do not forget to hit the like button and please do subscribe my channel.